Welcome to Connected Rheumatology. I'm Dr. Elizabeth Ortiz. Here we talk about all things rheumatology, immunology, diet and movement, and wellness, because it's all connected. Today's video is a little tough. We're going to be talking about some of the reasons why you might be having a hard time coming to a diagnosis. So stick around. To me that I should probably take a few seconds to introduce myself, talk about who I am, what I do, and why I'm doing this in the first place. So as I say at the beginning of every video, my name is Elizabeth Ortiz. I am a board certified internist and rheumatologist. Currently based out of Dallas, Texas, but I recently moved here from Los Angeles. I actually spent the last 16 years in LA. I did all my training there, and I was in academic medicine for almost 10 years in rheumatology. I decided, however, I wanted to build a new career for myself, on top of the fact that I'm originally from Texas and I wanted to be closer to my family, so I can't forget that. That was a huge reason for me moving back. But I also wanted to build a new career in medicine for myself, and that's what I'm doing here with Connected Rheumatology. I really believe that without education and effective communication, our health suffers. And through my practice with Connected Rheumatology, as well as through these videos, I'm hoping just to put some information out there so that we all end up speaking the same language. You know, we have these quick appointments. We don't really even have a chance now to look at each other because there's a computer in between us. And I really believe that that's how we end up overfed and undernourished, why we are wired, but then always tired, and why we're over-medicated for symptoms but never really getting to the root cause. So with these videos, I hope to just put out there into the world some information and some good vibes about health, medical visits, what I do, rheumatology, and if it inspires one person to just dig a little deeper and research some more, or to think about their own health in a different way, and then go have those conversations with their own doctor, then I've done my job. So with that said, let's get into today's video, why you might be having a hard time getting to a diagnosis. So this is kind of a tough, sensitive issue. I know that there are a million different reasons and situations out there why you might be having some difficulties with your doctor's appointments or your diagnosis. Maybe you don't feel like the diagnosis fits. And there's a lot of different reasons for that. You know, no doctor wants to make things more complicated or more confusing. But in our hurried medical world, it can feel like we see the doctor for 2 minutes, they are behind a computer, they give us a prescription and then pat us on the back and say to see you in 3 months. And it can feel really dissatisfying. It can feel really dissatisfying. Yeah, for the doctors too. And even worse, have you ever gotten those sheets, those discharge papers where it has the list of the diagnoses that your doctor has presumably talked about with you, and you look and there's things on that list that you've never even discussed and you don't really even know what they are? Yeah, this is the world we live in now. So unfortunately, there can be a lot of miscommunication and it can feel like you're not really getting anywhere. So let's get into it. The first reason why you might not be coming to a real diagnosis or getting to the bottom of things is your doctor simply doesn't know. Now, medicine has become huge. There is no way any one doctor can know everything in medicine. Everything has become a specialty or a subspecialty, even primary care. And you know, when you go to see a doctor with your problems and your labs, they are looking at that data through their specialist lens. And maybe that's the lens you need, or maybe it's not. You know, some doctors, in fact, I would say most doctors are very good at saying, you know what, this is out of my level of expertise, but some aren't. You know, one thing you can do to ask your doctor to see how comfortable they are is how many cases like yours they have seen. And what were the outcomes in those cases? That is a question you can use to try to gauge if this is the right person for you and your case. Another reason why you might be running into some obstacles is you think the doctors are saying all different things, but really they're all saying the same thing. Now, this is something that I actually see quite often. You know, the truth is, doctors spend a lot of years learning how to think and write and talk and read like doctors. And for many of us, we forget how to talk like normal human beings. And I completely put myself in this category too. And our hurried medical world and our quick visits do not do us any favors. This has nothing to do with how brilliant your doctor is or how compassionate a healer they are. Our training, though, sometimes trips us up. One thing you can do is take good notes, write down exactly what the doctor is saying, and then find a trusted primary care doctor or even a trusted specialist that you see regularly and take those notes and ask for a translation. It might take a few extra minutes, but in those extra minutes, you might find out that the doctors are actually all saying the same thing. Another reason that you might be getting frustrated is that the lab that one doctor is using to make the diagnosis is not validated and is not considered standard of care. Now, this one's a little tricky, and you would think that all labs would be considered appropriate and that everyone understands how to best use them and what they mean, but that's just not the case. Labs, just like any other test and just like medications, have to be vetted before they are widely accepted. And it can take a very long time for labs to be widely accepted in the medical world. You know, labs are coming out, or new labs are coming out all the time, and they get marketed to doctors, and some doctors really adopt them early, get excited about the information that they can tell you, and other doctors are a little more skeptical and wait until there's actual proof that what the lab is saying actually correlates with what's going on with the patient. And that can take a long time, and it needs to be used in a lot of patients before any particular lab result gets to that point. So what often happens is a person might go see a practitioner who gets real excited about a result of a lab that's drawn and uses that result to give a diagnosis. You can take that exact same lab to another doctor and they look at you and just shrug and say that doesn't mean anything. That lab doesn't prove that XYZ is going on with you, and that can be very frustrating. I would recommend that you talk to that doctor and ask them, well, what if I chose to believe this lab? What kind of treatment am I looking at? Am I looking at some sort of very strong toxic medication that comes with a lot of risks or side effects? Or am I looking at taking a daily vitamin or changing something in my diet? You know, the decisions we make in medicine are always a balance between the risk and the benefit. Now, you definitely need to be careful if you are going to go down a path that has the potential for a lot of risk for something that isn't quite standardized. But these are conversations that you need to have with your doctor, and they do take a little time, but knowing the exact question to ask can really put you ahead of the game. Now, another reason that you might be getting frustrated is that the history you're giving your different doctors isn't exactly the same. Now, this is certainly not to place any blame, but it's only natural that we focus on the symptom that's the most prominent when we have an appointment. So let's say you've been having frequent headaches. You go to see your doctor and you're complaining about the headaches. They give you a diagnosis that's centered around headaches. You then go see a different specialist, and although the headaches may or may not be happening, you've now developed hives. And you go to see that new doctor and you're talking about your hives. Well, you're going to end up with a different diagnosis, especially because they don't have that much time to spend with you to talk about what was happening a few months before. It is not uncommon for doctors to confer about patients and actually come to the table with completely different stories. This is where that symptom diary really becomes important. You can write down what's going on with you, and not just the symptom, but what was happening right before the symptom. What did you take for it? Did it help? All of those things will help you give a very clear history to all the different specialists that you're seeing. And finally, medicine is not an exact science. It is still very much an art. You know, in a world where I can get across the globe in 12 hours and I can talk to my friend who lives 4 time zones away and see their faces. I can get my groceries delivered in less than an hour. It can seem incomprehensible that someone can get loads of tests and still not know what's going on with them. You know, I've got more power in my, wherever it is, 6x3 phone to tell me things that I can take. I was about to say that I can take as truth, but you know, these days we actually, that's not true. But you get my point. Like, we have so much information and power at our disposal, and yet I can have blood and CT scans and MRIs and biopsies and still not be able to come to a certain answer about a patient's diagnosis. And it can be frustratingly humbling to have to tell someone we still don't know. And to be the person on the receiving end of that can be so disappointing. Unfortunately, I don't have a quick tip or recommendation for this one. This one takes a lot of patience, trust, and acceptance. And those are 3 things I know do not come easy. But if you stay the course, find yourself a caretaker, whether it's a doctor, a nurse, a therapist, physical therapist, who you feel comfortable with to talk to about the ups and downs. That will help you stay as strong as possible as you keep forging ahead on this journey. Those are my hot takes on why you might be having some trouble coming to a diagnosis. I hope you found something useful and something might resonate with you. If it did, make sure you give this video a like and make sure you subscribe. I'm going to be coming out with at least weekly videos, but I do have plans with coming out with some bonus videos, so you don't want to miss out on those. So make sure you subscribe. Also, check us out on Instagram, Facebook. Come out to connectedrheumatology.com. We have a whole page on other resources, things around the internet that I have found particularly useful for people with autoimmune conditions or other just chronic conditions, or people who are interested in just getting healthier. We also would love you to sign up for the newsletter, and little things can be delivered to your inbox. I think that's the way you say it. So anyways, thanks so much, guys, and we'll be talking to you soon. That's weird. Have a great day.